Hello, Long Beach. How is everyone doing today? I hope well. It's May the 27th, of course, 2020, and we have a significant update for everyone today. So we have a lot of information to share, and so I want to make sure that we welcome first, as we always do, we have Kelly Colopy, who is our Director of Health and Human Services, who runs our health department. She'll be giving an update today as well as reviewing the latest data. And of course, we have Alice from the health department, who will be doing our Spanish translation at the end. And then, of course, we have Paola, who is doing our ASL translation as well. So I want to just begin by letting everyone know that we have a lot to cover today as it relates to reopenings, how we're doing as a city and our data, and kind of what's next. And so kind of bear with us as we kind of walk everyone through all that. But there is good news. And so I think today is a day where we're going to have a lot of good news to share to the community and to everyone that's watching this update. And of course, we'll answer press questions at the end. So let me just kind of briefly kind of first review kind of where we have been. And then I want to discuss after that the governor's announcements from yesterday and how they relate to Long Beach. And then I want to talk about what our data says and how we're moving forward in the days and weeks ahead. So let me just begin by saying kind of where we have been. As a reminder, the city of Long Beach, of course, has our own health department, and we all know that. And we also know that the state health orders supersede the Long Beach Health Department. And so we can't move faster than the state, but we can move slower than the state. That's always been our options as a community and as a city. Anytime the state has made a move to reopen, whether it was the in-person dining, the curbside pickup dining, or the curbside retail, or some of the recreation activities, your city has moved to reopen those within almost always 24 hours of those activities being open. And so when the city has allowed us, or when the state has allowed us to, for example, open up the curbside pickup retail, we moved in real quickly to do that. And that's been the case because we have had generally better indicators in other parts of the state, and our health department felt good about our progress throughout this entire time. And so what we've done so far, so as of today, as you all know, we have had restaurants doing to-go and curbside retail. We've had the recreation piece, and so we've had public parks for passive and active use. We've had our beach bike path reopened, the beaches open for active use. We've of course done public courses and a lot of our trails across the city. So all of that has been open, and they've been open in partnership with our state and regional partners. And that has gone, for us, generally pretty well. I think we've shared with you the data as of last week. We've had a couple weeks now where our hospitalizations have generally stabilized. We haven't had a spike with all of those reopenings, which allow us to move forward and continue that conversation. And so what we know is yesterday the governor made some additional statewide announcements. And he announced yesterday that he would be reopening statewide and allowing counties and jurisdictions to open up houses of worship, retail shopping inside stores, and so going into the mom and pop boutiques, and some expansion of the other work we were already doing. But mostly it's the houses of worship piece and the retail shopping, which he discussed over the last 2 days, that he's allowing that statewide. And I want to just remind folks that there is a statewide baseline. And what that essentially means is that as governor, he's moving through those stages he put out, which is those 4 stages that we have gone through. Stage 1, which is about preparedness, which we've talked about extensively. Testing, PPE, hospital beds, ventilators. Long Beach has those. We've met that mark. Stage 2, which is the lower risk businesses. And those I just described. The curbside retail, the curbside restaurant pickup. And stage 2 also included other types of activities, like, as we know, the houses of worship, fully opening up retail establishments. And he had not allowed those to move forward yet for everyone. But he did yesterday. And so the first thing I want to begin today is we want to announce, and I'm really glad to be able to announce that beginning today in Long Beach, we are beginning by allowing houses of worship and our critical members of our faith community, our congregations and our churches to reopen, of course, with a series of guidelines and physical distancing and really strict safety measures, but we want them to reopen. And we're allowing today our mom and pop boutiques, our small retailers, those places that we all love to shop, or independent stores, the type of stores you find all across the city, whether it's on Retro Row or in Bixby Knolls or all across the city, in Belmont Shore, on 2nd Street. So these will all be opening up as of today. We are also, as of today, opening up offices citywide. Many offices that have been essential have already been open, but there are some offices that are closed, and so those will also move forward to open, as will a couple other smaller types of uses. For example, there's some uses today as far as HOA, some small pools and that are in some of our apartment buildings will be allowed to reopen moving forward as well, and we'll have more details on that in the order that's going to come out today. And so today, as we're speaking, and after this briefing, we're going to be putting out our new health order that will allow this houses of worship, allow retail shopping, allow offices across the city, and full manufacturing, most of which we've already been doing, on top of course, the curbside retail, the curb work that's been happening. All that will continue. And so how does that, what are some specifics there before we move on? So what does the in-store retail operations kind of look like? And what does it look like for offices and for retail? It makes that there's going to be work site specific plans for operation. Employees will be trained on these plans, and we have those available to everyone that will be put up. Retail will only be able to open at 50% capacity and make adjustments for 6-foot and physical distancing. Both retail and offices must maintain physical distancing protocols, as well as cleaning and disinfecting. Offices where employees can operate via telecommuting should continue to do so. So if offices are telecommuting employees now, we encourage that to continue. We think that's a healthy way to keep folks safe and to keep the economy working. So telecommute if you can, but offices can begin to open. We also know that we're going to have a process in place to identify new cases and illnesses quickly. And businesses will have a process and connection to contract tracing to ensure that we're not also spreading the virus. And those guidelines, by the way, align with the guidelines that are being put in place by the state, as well as our partners across the county. Because as we're doing all of this today, the County of Los Angeles is doing the same thing. They're opening up all of these locations. Now let me discuss reopening our places of worship and spiritual centers. We're excited that these places will begin to allow to reopen. Attendance will be limited to either 25% capacity or 100 people, whichever one is lower. We want to remind folks that places of worship across the country have been difficult in some cases because of the closeness of spaces. So we really need our places of worship to be careful during this reopening process. And to really try to avoid things like sharing prayer books and hymnals during this time. But we are optimistic that in talking to our faith leaders, and I've done that multiple times, that they are ready to do this the right way and to continue to doing some of the virtual work that's happening and the virtual communication that's happening as well. And so we appreciate all of that. And so to review then, the governor allowed the uses that I just described statewide yesterday, and today we are allowing them as well in Long Beach, as is the County of Los Angeles, including, of course, the City of Los Angeles. And so we're thankful that our mom and pops now have access to their customers again. I think a lot of people early on were frustrated as to why they could go shop in a Target and buy the goods they needed, but they couldn't go into a small mom and pop and buy those same materials. And we were frustrated about that as well. But just as a reminder, these were state guidelines that we've been following, and the day that the state allowed them, the mom and pops, which was yesterday, we're doing it to 24 hours later today. And I want to thank all of the small retailers that have been partnering with us. Now I want to talk about some other industries that are moving forward in a different way, and I want to give some good news in the days ahead, and I want to share with you why. So we've been talking about some other industries as well. You may be reading about in other parts of the state, for example, restaurants are beginning to have in-store dining. You might be hearing about some salons opening up in other parts of the state, including Orange County. And that's true. Those other counties, like I've mentioned before, have been able to apply for what's called a variance or a fast track to reopen and go through the stages faster. How have they been allowed to do that? They've been allowed to reopen faster because essentially they have met certain health criteria that we've discussed in the past that allows them to reopen faster, and the state basically approves an application. So you submit an application, you meet the criteria, you're either approved or denied by the state, and if you're approved, you can open faster. So in the case of Orange County, San Diego, I believe San Bernardino, and certainly all of the rural counties statewide, they have all applied for these variances because their health indicators allowed them to do so. Who had not applied yet? LA County, Long Beach, the Bay Area, San Francisco, Oakland, all the denser communities had not yet met those criteria. And those criteria and that fast track essentially allows two additional industries to move forward. One is it allows restaurants to open up their dining rooms, of course at a limited capacity, but beginning to open them up. And it allows barbershops and salons to reopen up. I've said before, and I talked to a bunch of barbers earlier today, last week, and restaurant owners. These small business owners are eager to reopen up safely, and we understand that, and we want them to open up in a way that is safe. We also know that we have not yet met those fast track opportunities. But the good news, and that's what I wanted to announce today, is that as of today and this morning, Long Beach has submitted a fast track variance application with the state of California. And we are very optimistic that because our health indicators have met the state's requirements, that we are going to be approved, hopefully within the next day or two, to join the fast track group of counties and cities across the state of California. So what does that mean for us, and how did we do this? First, it's important to note that we submitted our application in partnership with the city of Pasadena and the rest of LA County. So we submitted it as a county. So all 88 cities, including the two that have our own health departments, Long Beach and Pasadena, and LA County, all submitted together, one application today. In fact, just a couple hours ago. Why did we do it that way? We did so because the Long Beach application is stronger with the LA County partnership, and the LA County partnership application is stronger with the Long Beach data. And to explain, we in Long Beach have done some really great work as it relates to health and preparedness. So is LA County. In some areas, they're doing just a little better than us. In others, we're doing just a little better than them. But combined, we meet all the criteria that is required of the state to move forward, and which is why these partnerships are so critical. We've had a lot of questions from individuals, and some angry, and I understand. Why haven't we applied for a variance? Why aren't we applying as our own city? And I hear that over and over again from folks, and I understand that. But I want to just remind folks that had we applied for a variance or attestation 2 days ago, we would have been denied. If we would have applied last week, we would have been denied. We applied today because it's the first day possible where we actually met the health indicators to get our application approved. So It's important for us to stay focused, steady, and to do the right thing when the timing is right. And so while I understand the calls to apply or break away quicker, those would have been the wrong decisions because we would have had our application denied. But today, with the partnership that we've already established with LA County, we make each other's application stronger. And I can tell you with confidence, while we don't have the application that was submitted today, we believe strongly that this application could be accepted within the next 24 hours, maybe 48 hours. And what does that mean for Long Beach? It means that as early as this weekend, or at some point this weekend, as early as we could see the beginning of some of our restaurants that have dining rooms and our barbershops and salons begin to slowly reopen in a way that is safe. It also puts Long Beach in the fast track category and separates us from the other counties and other areas that have to move slower. But that's only because we met the health indicators. And I want to touch on that just 1 second. We have been hearing for a long time, and I hear it, I see it on social media, in messages that I get to the office. A lot of folks upset because things were closed, or wanting us to reopen faster, or want to defy the state. If we had done all of those things, we would not have been able to reopen today as much as we have, because our health indicators are now strong enough to do so. And so this idea of opening up too quickly would have cost us our ability to now support these small businesses, like our salons, like our barbershops, like our restaurants, to move forward. And so the timing, in my opinion, and in the health department's opinion, has been just right. And I want to thank our LA County partners. We would not, I also hear oftentimes we're our own city, and we are. We're a city of 500,000 people. This is a huge community. But what happens in Long Beach affects Orange County, and what happens in Long Beach affects Los Angeles. And what happens in Los Angeles affects Long Beach. We are not immune to what happens across our borders. So if we don't work in partnership with all of our neighbors and friends, we are not going to get through this together, and our hospitalizations and our data will go backwards. We have to all succeed, or no one succeeds in our region. That's just the way it works. A lot of you work in Los Angeles. A lot of folks that live in Orange County work in Long Beach. So we are united in our success, which is why we've all got to succeed together. And let me also just add that it's because we have strong partnerships with the state, with the California Department of Public Health, with the governor's office, and with others, that we're at this point where we are today, which we're able to safely reopen pretty significant parts of the Long Beach economy. And now I want to clarify on a few things on how we reopen. If you have a lot of questions about, well, what does it mean to open up a salon? What does it mean? How can I open up my restaurant? Those guidelines are going to be put out by the city as soon as we get our application approved here in the next day or two. But I would also encourage you to visit the California COVID website at ca.gov if you are a business owner. And they have guidance and suggestions already for salons and barbershops and for restaurants that you can begin preparing for as the city of Long Beach begins to put together our health orders and our guidelines for all of you in the days ahead. And I want to also just note that as a reminder, we still are in a health crisis. There's still no vaccine. And at any moment, our progress can be halted, moved backwards, and at any moment, our hospitalizations or our deaths could spike up in such a way that we would have to stop or begin to go backwards. And that could be, and that's something that could be done locally or at the state level by mandate if we don't do the right thing. And so this is also my plea to all of you. We are here because we have generally been responsible. We're able to reopen because for the most part, Long Beach has done the right thing, and we didn't rush. If we had rushed, we wouldn't be able to reopen. If people just flouted the rules consistently, we would not be at a place where we could reopen. And so what we need to do now is do the right thing. All the other businesses are counting on us to do the right thing. And doing the right thing means wear a face covering or mask when you go outside your home. If you're going to be around other people, put on a face covering. You are not allowed to go into a business or restaurant without a face covering or mask. And if you're a business owner, please enforce that rule. If you're out walking on the street, chances are you're going to run into somebody. Wear a face covering and mask. We understand that it is not mandatory if you are alone or if you are with family walking in your neighborhood. We understand that. But honestly, 99% of the time that you are outside, you should be wearing a face covering or mask. And wearing one, in fact, is in my opinion, a show of strength, and that you care not just about yourself and your family, but about the people around you, and that you care about our small businesses. And so I just hope that we continue to do that and to do the right thing, because this continues to be serious, and all this progress can be stopped in an instant. So let's continue to move forward. And then I'll say, and I'm going to turn this over to Kelly after this last announcement, who will go over some of the some more details about our numbers and kind of how serious it is that we do the right thing. Finally, starting this weekend, we're going to begin by expanding our testing to anyone that wants a test, and essentially for folks that are asymptomatic, that are showing no symptoms. We have obviously been testing up to this point, for the most part, any worker that's going back to work, obviously our nursing facilities, our medical folks, essential workers, and we have been experiencing in some cases some really long result times, which is why we have not gone further, even though we have the capacity to do 1,000 tests a day. That result lab time is now shrunk as we've gotten kind of a better grasp on the amount of tests we're doing, and the labs have. And so beginning this weekend, the Cabrillo High School site only will begin testing anyone that wants a test, including anyone that's symptomatic or not. So the testing site, of course, is the COVID-19 site, and then we will expand that to other locations as capacity allows us to. But we still have 6 sites. 5 will remain limited to essential workers and those in the workplace now. 1 will be open to anyone else that wants to get one, and then that will expand to the other locations over the course of the next week and weeks ahead. And so with that, let me just say that our health department, and under Kelly's leadership, has been doing a phenomenal job, and they're working like everyone in your city every single day. No one has taken days off since this whole thing started, and she's leading that amazing team of doctors, nurses, health specialists at our health department, and doing a really great job. And so I want to thank her for her amazing work, and I'll turn it over to Kelly for the update.
Thank you, Mayor. I'm going to just provide a little bit of data, our daily updates. We now have 1,666 residents who have tested positive for COVID-19. Approximately 1,184 of those people have recovered. We are sad to report that we lost 6 Long Beach residents since yesterday. All of them had underlying health conditions. These data reflect from Monday and Tuesday's cases, and then one from last week that was from out of town. This brings our total of COVID-19 deaths in Long Beach to 81 total, of which 62 of those have been associated with our long-term care facilities. We continue to spend a lot of time working with our long-term care facilities to ensure that folks are safe. And we've seen a lot of stabilization. We've seen a lot of different long-term care facilities where we have not seen any additional cases. They're doing a great job with us, and we're doing everything we can to make sure that we continue to improve the conditions and to ensure that they are safe and safe. For all of you public health history lovers, I'm sure there are many of you out there. In public health, we study and learn from the past to help inform our efforts today. Just over 100 years ago, the 1918 influenza pandemic infected about 1/3 of the world's population at the time and killed more than 675,000 Americans, including 150 in Long Beach, which had only a population of about 50,000 at the time. When officials ended preventive measures and opened schools and churches and businesses back up, the virus returned with a vengeance. While many people were sick during the first wave, most deaths came from the second and third waves. We now have the benefit of these lessons, modern technology, data science, incredible technology, and public health planning to inform our response. But we still need to be very careful. We'll be using all the different tools to guide us, and as we reopen, the actions that you take today will impact what Long Beach looks like in the weeks ahead. So we've been paying a lot of attention to different indicators. I've shared those with you a lot last week. But so the state of California, as you know, established criteria to determine when it was safe for us to open. Really, it's the ability to test, the ability to contact trace, the ability to protect those who are high risk for COVID-19, particularly those experiencing homelessness and those in skilled nursing facilities, and that we have surge capacity for our hospitals and across our health systems. The data show that we're doing a good job with containing the virus. We've been pretty stable. Hospitalizations and ICU trends as a result of COVID-19 have remained fairly stable. Our local hospitals are currently at 60% of bed capacity, and we have the capacity to handle a surge. Our inventory of personal protective equipment is over 1.25 million pieces. We've increased our testing capacity throughout Long Beach, where in partnership with our hospitals and private labs, we have 6 testing locations that have conducted over 31,000 tests in the city. Our positivity rate is now 6.3%. In addition, we've grown our contact tracing team to over 60 people and are joining the statewide contact tracing data system to allow us to more easily identify and notify individuals of their potential exposure. You can view all of our data on the data dashboard at the COVID-19 website to track our trends. So all of that being said, as the mayor discussed, we are still at a critical junction. While the data show that we've met the state's criteria for reopening more businesses, it's just so important that we don't relax our personal preventive measures. Your actions today will shape what next week will look like. It's really easy to think everything's open, so I must be better. It must be okay for me to be out. This is the time you have to be particularly vigilant in taking precautions. It's making sure that you're keeping your distance, that you're wearing your face coverings, that you're washing your hands, and that you want to act as if everyone around you has COVID, or that you do, and that you want to make sure you don't get it, nor that you want to spread it. Just if you act from that perspective, we'll do much, much better moving forward as a city. The virus is still out there. It's more important than ever to continue taking the steps to protect yourself, which is the physical distancing, wearing a face covering, as the mayor said, whenever you're around people and when you're visiting any business, respecting capacity limits of the businesses as they're reopening. So you're hearing they can only reopen at 50%. So respect that. And then also, if you end up in a line outside, that you have the 6 feet, right? So as you're in line, make sure that you're respecting the 6 feet protocols. Wash your hands and stay home if you are sick. We can prevent a second wave if we all do our part, respect each other as our city reopens. We're all in this together. Please do not undo all the progress that we've made. And I want to thank you so much for your support during these times. It's been incredibly difficult for each of you in your own situations, and we just want to thank you for all that is taken to allow us to start to reopen. We just ask you to continue to carry on with all the steps we need to take to make sure we're safe and healthy as a city. Thanks. I'll hand it back to the mayor.
Thank you, Kelly. And I do want to just, because I think you mentioned it, I see a lot of the kind of angry, sometimes emails or things that folks say to our health officers, and that demand things to reopen on the next day. And I understand where some of that comes from, because you have business owners who are struggling, whose families are being affected, or workers who are out of a job. So that comes from a real place for many folks, and I get that. But I also want people to understand that the decisions that are being made have been made in a way that's been steady, consistent, and based off health indicators, data, and science, and directed by our health department. Decisions aren't being made because someone feels like it, or because they're hearing from one group or one business. They are being made because we believe we have the capacity to absorb impacts that might happen. And as a reminder, and the governor said this, I think it was yesterday or the day before, the state believes, and we could as well, that we could see an impact from all these reopenings. We shouldn't expect everything to to work out exactly as we planned it, because we cannot control every single person in our community and whether they do the right or the wrong thing. And so we will see how we do. And we're hoping that everyone is as responsible as possible. And that being said, we're going to be more vigilant than ever. If you are a business owner and you're doing the wrong thing and you are flouting the law or you are not following the guidance, we need to know, and you need to be responsible to support the other business owners. And as us as residents, as we're out there, let's do the right thing and support all of the work that's happened. Let's not go backwards. We don't want to undo all the work that's happened. Let's continue to stay healthy and safe. And so I want to thank all of you for that. And we will let everyone know. I expect that possibly by Friday at our next briefing at 3 o'clock, we'll have more information and an answer on our application to the state of California to move forward on the in-dining restaurants and the barbershop and salons. And one clarification point we didn't make, the governor, in his announcement on barbershops and salons, has only singled out barbery and salon. So if you are a nail tech or a esthetician that does facials or massages, that is yet not on the fast track, and that is not yet on the list to reopen. We expect those are kind of next in queue, but it's just kind of the haircuts and the barbers per the state. So I just want to make that clear as well. And with that, we'll take any questions from the press.
Thank you, Mr. Mayor. The first question will be coming from Rachel Jordan from ABC 7. Go ahead, Rachel.
Hey, so this question is for the mayor. So what constitutes a business as a small retailer, and how does this reopening affect the Pike or Second and PCH? And regarding reopening moving forward, is the city completely aligning with the county?
So I think it includes any retailer. So any retailer, whether you're small or large, can now open starting today across the city of Long Beach. In fact, across the county of Los Angeles, because they also have moved forward with this order, because these are now, obviously, the state has allowed these to open. And remember, we can't move faster than the state's announcements, we can move slower. And so there are many parts of the state that are still not allowing in-person retail. But Long Beach, we believe that we can do so safely. But it also requires a series of guidelines that folks have to follow. But I would argue that one can be as safe walking into a mom and pop in Bixby Knolls, a boutique, than going into a Target that has thousands of people going in and out of it. And so it's our small mom and pops that really need the support. And the city in Long Beach, we have more smaller businesses than we do larger. So we're a town of small retailers and mom and pop shops, independent places. So if you're a retailer, you can open, but you have to do so safely. And my message to every retailer is make sure all of your employees and workers should have the proper face coverings, should have their masks, and those coming into your store should as well. And in addition to that, there are state studies, and we've had conversations with business owners as well and the public. If I am a customer and I don't feel safe going into your establishment, I'm not going to go in, or I'm going to be less likely to visit your establishment. So it's up to the small business owner to ensure their place is both safe and is perceived as a safe space for folks to feel comfortable. And again, every retailer might not open immediately. There are some that want to take their time, others that'll need days or weeks to ramp up. And quite frankly, a lot of folks are still going to stay home, particularly people that are immune compromised, seniors, folks that have issues as it relates to being really susceptible to COVID-19 because of other health conditions. A lot of those folks are going to continue to stay home, and they should. And so I think that's where we're at as with retail.
Thank you very much, Mr. Mayor. The next question will be from Kelly from the Long Beach Post. Go ahead, Kelly.
Hi there. Was hoping to get a little bit more detail on what changed between yesterday or the day before and today on some of Long Beach's indicators where city officials feel confident in sending this application to the state. Because if we look at some of the key indicators like hospitalizations are actually up a little bit slightly. and we had 6 more deaths today. So just trying to get a better understanding of what's the difference between today and yesterday.
Absolutely. So I'm gonna say a few comments, and I'll let Kelly go into the details of it. So, and Kelly can go over actually what the indicators are. Obviously, just to note, the 6 deaths were over 2 days and then 1 date, I believe, from a week ago. And so it was, I think those are over 3 different days. I know it's a lot, and each one is serious, but just to clarify that. The key difference, and Kelly, you can add to this, is our positivity rate on the testing side. Today, this morning, decreased under the 8% threshold. And as Kelly mentioned last week, that was the last main indicator that Long Beach needed to be able to apply for the variance, because we had met all of the others, and the county met that issue. And the contact, they needed to hit their contact tracing number, which they met. Our contact tracers made their application stronger. Their numbers as it relates to the positivity rate and others made ours stronger. And Kelly, did you want to go through the different categories that we met?
I think as of Friday, as the mayor said, we had met the. So one of the things that you look at is percent increase over 7 days for hospitalizations, and our numbers have been fairly stable. They're a little bit higher, but they haven't gone any higher than the high 60s. We've seen that number before, but we're not going any higher than that. So those numbers have been fairly stable, and we meet the criteria that we haven't had a large increase. You have to have a 35% surge capacity for your hospitals. We do meet that as well. As the mayor mentioned, the positivity rate is now at 6.2%. It was at 8.6% before, so that number has decreased. Moving forward.
You need it to be under 8%.
It needed to be under 8%. It's now 6.2%. And then the skilled nursing facilities, the ability to provide 14 days of PPE. The skilled nursing facilities have a number of those on site, but we have capacity within our warehouses to be able to support that moving forward if they were to have an outbreak. And then trying to think, there's one more. Oh, case contracting. You have to contract tracers. You have to have 15 per 100,000. We currently have over 60. So we have built that capacity. Most have been fully trained. Another group is heading into training right now. And then the state is providing a database that captures all the different data, assists with the ability to isolate and quarantine, notifying folks. And then the testing is for us, we needed to be able to provide over 750 tests per day. We've had that met for a long time. And as the mayor mentioned, our turnaround times are back down to 48 hours at all of our sites, thanks to some very hard work with our teams and with the labs, and we've shifted out some technologies, so all that is now in place. So we feel comfortable that when people are tested, they'll receive their results quickly, and that we have the staff to contact trace to be able to identify them. And those are the key pieces as a system that need to be in place to move forward.
And again, a few days ago, our positivity rate was not where it's at today. And so you look at that rate over a certain amount of time. And so the main thing that changed, Kelly, correct me if I'm wrong, is getting under the 8%, which we're now down to 6.3. So that's the key indicator that has changed. And so the reason why we moved and the county moved towards the variance and the fast track was because those indicators headed absolutely in the right direction. And again, those indicators are set by the state, not by us locally.
The next question will be from Haley from the Press Telegram. Go ahead, Haley. All right, we'll go ahead and come back and try one more time. Question for Valerie. Valerie, go ahead, from the Long Beach Post.
Hey, so many people went to barbecues and hung out at beaches on Memorial Day. So now that we're reopening more, when will we be able to be allowed, I guess, to see people outside our households and gather for parties and that kind of thing?
And if you look at the governor's order, that's a stage 3. That's a stage 3 opening. So we are now in sort of late stage 2. We're entering sort of the end of stage 2 if we have this variance moving forward. So that will bring almost the entire state together at that point, except for some of the Northern California counties. At that point, they'll start to look at gathering sizes and being with folks who are outside of your household.
All right, looks like we have another question from Kelly. Kelly, go ahead with your question again.
Yes, with the state allowing LA County and Long Beach to apply together, it almost sounds like the state is allowing LA County to cherry pick Long Beach's numbers, which are showing, like for positivity rates, for example. Is that the case? Is Long Beach and LA County allowed to just give certain numbers for indicators as opposed to an entire average?
No, so they're including our numbers into theirs. So their positivity rate is also below 8. So it's not a cherry picking one or the other. Their numbers are already in that space, and so are ours. They've also met all the other criteria. So while it strengthens the application, we could have applied on our own, and they could have applied without including us. And instead, we decided to move forward as a partnership, just to provide the overall regionality in the work that we're doing.
Absolutely, and absolutely. So we could have absolutely gone through the process alone. The difference is combined, it's stronger. And so an example might be the contact tracing. And so certainly if LA County had gone without us in Pasadena, they would have less total contact tracers countywide. And so with our contact tracers, it strengthens the whole contact tracing kind of sector within the application. And we have been, our health department has been in contact also with the state. And so in the process of applying for the variants, we've been hearing from them kind of the best way also, what's the best way we can present our story in the region. And that's why kind of we all went together because the story was stronger as a region. And even though individually we had met those goals as well.
So Haley actually responded with a question, and we're actually going to read the question out here from the press telegram. And her question is, Mayor, my question is about restaurants allowing dine-in soon. What's the status of Open Streets Initiative, and how will this factor into dine-in reopenings?
Well, factor into it a lot. The Open Streets Initiative is moving forward. We actually expect to have our first open street projects, probably a handful of them or so, this weekend, possibly starting this weekend. And of course, they'll exponentially grow in the weeks ahead. But if we get this variance, which we're going to get, I think we're going to get, those will be more needed than ever because restaurants are going to need to distance, and because capacity will be limited inside those dining rooms, they're going to need the outdoor space. And so we're working furiously with the restaurants, the business improvement districts to get the space open. And just to remember, I've talked to a lot of restaurant owners that aren't going to reopen their dining room, that they want to just do takeout for now. They want to wait a little bit longer. Others that just want to open up maybe patio dining. So you're going to see a variety of different reopenings up to the individual restaurant owners. But the Open Streets Initiative is more important than ever. I'm so glad that we moved on it early, that we didn't wait, but that we have been planning and we're doing the work for a couple of weeks. So we're going to be ready to go right when restaurant dining rooms will be ready to be reopened. And that's going to be a good thing for Long Beach.
Thank you very much, Mr. Mayor. Well, understanding we're somewhat tight on our time, I just want to really highlight a couple of statistical numbers that people have asked about on our Facebook Live here. And one of the questions was, how many people have been tested? And I just want to share this with the audience there. We've had over 20,620 people tested today as of this morning in Long Beach. So Kelly, do you have anything to add to that?
So those are the numbers through our drive-throughs only. We've actually had over 30,000 people tested when you include people coming through hospitals or their private providers.
I think it's probably close to like 31, 32,000
right around
total.
31,000.
Yeah.
So, and then in addition to that, currently hospitalized, the last data that we have is 67 based on your statistics earlier today.
That is correct.
All right. That does it for us, Mr. Mayor. Back to you.
Thank you. And now, again, thank you all. I know it was a lot of an update. We're going to get a recap also in Spanish for folks that watch us in Spanish. So thank you, Paola.
Hola.
And Alice.
Hola, muy buenas tardes. Gracias por acompañarnos hoy, este miércoles 27 de mayo. Es nuestra sesión informativa. Como saben, hemos dicho esto varias veces, la ciudad de Long Beach sí tiene su propio departamento de salud. So, sí hacemos ciertas órdenes de acuerdo con nuestra ciudad y nuestro departamento de salud, pero también, como les hemos dicho, también no podemos seguir adelante con reabrir sin el permiso del Estado de California, y también siempre nos gusta también alinearnos con el Condado de Los Ángeles. Pero desde hoy sabemos que algunos de los negocios que han estado abiertos solo han sido los restaurantes como para comida para llevar, o para entregar en casa. Y también poco a poco hemos reabierto la área de caminar en los parques, áreas de recreación, las playas para nadar y cosas así. Pero desde estamos entrando como en la segunda etapa, pero al final de la segunda etapa. Y desde hoy aquí en la ciudad de Long Beach estamos reabriendo las iglesias y también algunos... En las iglesias, primeramente, queremos nomás decirles que van a ser el límite, la capacidad, como el 25% se va a permitir. También algunas de las oficinas van a reabrir poco a poco, pero todavía se les recomienda a esas oficinas a que deje que sus empleados trabajen desde casa porque es lo más seguro en este momento. Si se puede todavía seguir a trabajar en casa, su negocio le dejará, le avisará y es lo más seguro en este momento. También algunas otras tiendas para comprar adentro, no nomás afuera y recoger al lado de la calle o en la banqueta, sino que también pueden empezar a reabrir las tiendas pequeñas, los negocios pequeños para que puedan hacer sus compras adentro. También sabemos que ha visto muchas preguntas, todavía no está abierto totalmente todos los negocios y recuerden que todas estas decisiones están alineadas con las pautas del Condado de Los Ángeles y el Estado de California. Sabemos, han visto muchos programas, el alcalde se ha reunido con muchos de los negocios de barbería y los salones de belleza y entonces desde hoy apenas lo único que hemos hecho en este momento es aplicar para una varianza para poder reabrir esos negocios rápidamente. Creemos posiblemente que tal vez para más tardar el viernes podemos tenerle un poquito más de información sobre esos negocios y cuándo pueden reabrir. Nosotros, como le decimos, somos una ciudad muy grande, hay más de 5,000, casi 500,000 de personas que viven en la ciudad de Long Beach, no somos una ciudad pequeña y entendemos que lo que hacemos en Los Ángeles tiene que ver y afecta a lo que está pasando en la ciudad lo que hacemos en Long Beach afecta a lo que está pasando en el condado de Los Ángeles y viceversa también con el condado de Orange. Hay mucha gente que vive en Orange, trabaja aquí en nuestra ciudad, es muy importante que nos reunamos y nos equipemos juntos para poder reabrir estos negocios. El riesgo... Todavía corren muchos riesgos. No significa, solo porque estamos reabriendo un poco más de negocios, no significa que estamos reabriendo totalmente. Y sabemos que todo esto también sí, posiblemente puede venir con consecuencias. Es muy importante que todavía sigamos practicando el distanciamiento físico. Todavía cada vez que salga de su casa y cuando sepa que tal vez no va a poder estar más de 6 pies separado de una persona, es muy importante seguir usando sus coberturas faciales y también quedándose en casa si está enfermo. Nuestra directora del Departamento de Salud, Kelly Colopy, está aquí con nosotros otra vez esta tarde y nos dio nuestros más recientes datos de nuestros números. Desde hoy hay 1,766 residentes que han sido positivos del coronavirus. Aproximadamente 1,184 personas ya se han recuperado. Nos entristece informar que hemos perdido a 6 residentes de Long Beach desde ayer adicionalmente. Todos de esos 6 personas que fallecieron también tenían condiciones de salud subsiguientes. El total de muertos por el coronavirus en nuestra ciudad de Long Beach ha sido 81 y 62 de esas muertes han sido asociados con centros de enfermería y de atención a largo plazo. Saben que nosotros que estudiamos en la área de salud pública siempre estudiamos lo que ha pasado en la historia y en el pasado con otras enfermedades y otras pandemias como esta. No hace mucho tiempo, como hace, por ejemplo, unos 100 años atrás, hubo una pandemia de la gripe y en ese entonces solo vivían como 50,000 personas en esta ciudad de Long Beach y se murieron aproximadamente 150 residentes. Es bastante y aprendimos mucho en ese entonces. Sabemos que el momento que después de esa pandemia, inicialmente reabrieron iglesias, reabrieron escuelas y cosas así, empezó y regresó el virus con un poquito más fuerte. Eso es lo que estamos tratando de prevenir. Siempre queremos usar esos ejemplos para seguir adelante en la ciudad de Long Beach. Muchas personas se enfermaron durante la primera ola. Ahorita lo que queremos es prevenir un riesgo que nos contraja una segunda ola de esta pandemia del coronavirus. Ahora tenemos el beneficio de elecciones, más medicina moderna, la ciencia moderna, datos, tecnología increíble y planificación de salud pública para informar en nuestras respuestas hoy y cómo es que nos preparamos para prevenir una segunda ola. Utilizaremos todas estas herramientas para guiarnos y algunos indicadores que estamos viendo para reabrir en nuestra ciudad es que el Estado de California estableció criterios para determinar cuándo es más seguro que los condados vuelvan a abrir. Y algunos de los criterios incluyen la capacidad para más pruebas, rastrear contactos, aislar y apoyar a los que están expuestos al virus, la capacidad para proteger a las personas con alto riesgo del coronavirus, un aumento de la capacidad de los sistemas hospitalarios de salud, la capacidad de empresas, de las escuelas, instalaciones de cuidado infantil para apoyar el distanciamiento físico. Cada uno de estos negocios o escuelas tienen que planear, necesitamos tiempo para planear cómo va a ser más seguro reabrir estos lugares. La determinación de cuándo establecer medidas, cómo quedarse en casa. Los datos muestran que estamos haciendo un buen trabajo para contraer el virus y esta segunda ola también. Nuestros hospitales locales que tienen actualmente una capacidad de cama al 60%. Y también que nuestro inventario de equipo de protección personal sea, por ejemplo, como para un centro de enfermería de largo plazo, queremos asegurarnos que tengamos por menos 14 días de equipo para estos lugares si es que se brota exposiciones en estos lugares. Algunos pasos para reabrir y más seguro es que todavía estamos en una coyuntura muy crítica. Los datos sí muestran que hemos cumplido con los criterios del Estado para reabrir negocios. No podemos relajar nuestras medidas preventivas personales en este momento. Sus acciones de hoy darán forma a la apariencia entre la próxima semana. Es más importante que nunca continuar tomando los pasos necesarios para protegerse a sí mismo, a sus hogares y en pleno a toda nuestra comunidad. Practique el distanciamiento físico, como le dijimos anteriormente también, cada vez que visite negocios y también asegurarse que los dueños de negocios, que todo su personal y sus empleados también estén usando esas prácticas para protegerse a ustedes, sus negocios y al público. Siempre recuerden usar su cobertura facial, es mejor cargarla en sus bolsas, cargarlas en sus automóviles para siempre estar listos con ellas, pero recuerden también de lavarlas después de cada uso. Respete los límites de capacidad de las empresas también a medida que vuelvan a abrir. Lo último que necesitamos es que poco a poco reabramos los negocios y por negligencia o por no seguir las órdenes de salud tendremos que hacer cosas de nuevo como cerrar los negocios y eso es lo que estamos tratando de prevenir. Siga lavándose las manos a menudo, quedarse en casa si está enfermo. Todos juntos podemos evitar esta segunda ola si es posible. Solo es importante que todos estemos juntos en eso. No hay que permitir el regreso de todo el progreso que hemos realizado hasta ahora, pero definitivamente queremos darle gracias a todos ustedes, a nuestra comunidad de la ciudad de Long Beach por seguir las órdenes de salud y por poner de su parte para poder prevenir otros números de pruebas positivos. Muchas gracias, es todo por hoy esta tarde.
Y muchas gracias, Alice. And again, just thank you all. We know there was a lot. We'll have a lot more information on Friday. And again, we hope to hear and have good news on Friday about our application, which we think will go well. So thank you again for watching. And please stay safe and keep everyone safe around you.